You mentioned AstraZeneca, and our Meg Terrell this morning does have more on what the CEO said this morning about the trial and the pause. Good morning, Meg.
Hey, Carl. Well, that pause does remain in effect after that unexplained illness. And one participant in AstraZeneca's COVID-19 vaccine trial in the UK, Pascal Soriot, the CEO of AstraZeneca, speaking at an event in the UK this morning organized by Tortoise Media, saying that if they are able to restart their trial, and depending on when, he believes they will have results by the end of the year and could potentially file for approval, so a vaccine would be available around then or in early 2021. Now, he also noted that they are still awaiting the official diagnosis for this woman, and the trial restart date is unknown. The decision about that is in the hands of an independent safety committee. Here's how we put into context this kind of event in a vaccine trial.
It is very unusual for a vaccine trial to not stop like we did. It's very common, actually, and many experts will tell you this. The difference with other vaccines trials is the whole world is not watching them, of course. So they stop, they study, and they restart. So what happened here is not uncommon.
So Soriot is saying the whole world is watching these vaccine trials, and of course we know that's true, which is why eyebrows were raised yesterday when information about what caused the trial to halt was disseminated not publicly by the company, but on a private investor call arranged by J.P. Morgan that was reported on by Adam Feuerstein at Stat News, where Pascal Soriot revealed that the participant had received the COVID-19 vaccine, not the placebo. And of course, guys, this doesn't mean we know that the vaccine caused this event, but it was a detail that we didn't have among others. And we should say J.P. Morgan's analyst has written up a synopsis of that call, which we have. We still do not have a transcript of that call. Meanwhile, of course, there is skepticism about vaccines in general and the pace at which they're being developed. A Kaiser poll out today shows that 80% of people that they polled don't expect a vaccine will be approved before Election Day. And guys, if one was approved that early, 54% say they would not get it. Back over to you.
Meg, this seems like total amateur hour. Adam Feuerstein's he's an old friend of mine. He worked with me for years at the Street. He's at Stat. He's completely reliable. Made it sound like, look, it's really possible this could be an event. What did I do immediately when I heard him? I pulled out of the Moderna trial, canceled. I just think that when they're they had the lead. Now it sounds like they're going back. This gentleman breaks the news at a J.P. Morgan conference. I'd like to see about Reg FD problems there. Meg, what is about this decision that has total amateur hour written all over it?
The decision about the communication?
Yeah, the communication. I mean, this is the most important news when it comes to the vaccine. But I'm going to get it from a J.P. Morgan conference and Select dissemination. I get it from Stat. I get it from you. The story's different in each case. We need 30,000 people for these tests, and suddenly people just say, wait a second. I mean, I can't think of a worse. I'm trying to debate a worse way to handle this, but I haven't come up with it yet.
I think you hit the nail on the head, Jim. I mean, Pascal Soriot said it himself this morning. The world is watching these trials. And so while I have heard the argument that the information he shared on the call was not material, I mean, if you look at the stock price yesterday, they held this call at 10 a.m. The stock had declined the day before in after hours by as much as 8%. It had already recovered significantly way before 10 a.m. So, no, the call did not move the stock. But and other people say the information, we're treating this as such a huge event, but some experts say trials are always stopped. So we should not be treating this as a huge event until we know more about it. So that's the devil's advocate argument. But if you're going to share that information and it's going to then get out and it is so closely watched, it might increase the fear that people have around this trial and the transparency of the communications. And anything along those lines is damaging in this environment right now.